I want to do another measles update because I'm seeing a lot of false information going around about this measles case, and so I want to clarify a couple things. One is that there have not been 2 deaths, despite what RFK said. There have not been 2 deaths. There's been 1 death. This was verified through the state Department of Health, and then that we don't know why this child was admitted. We don't know their health history. We don't know their health status or anything like that. All we know is it's a school-aged unvaccinated child. This screenshot of being infected with RSV and pneumonia and then contracting measles in the hospital and then dying from measles. Nowhere has that been actually reported from a credible source. Additionally, as RFK said, that they were admitted, most of the people in the hospital for measles were there for quarantine. That's also untrue. The chief medical officer of the hospital where these children are admitted says, no, that's not true, and they are mostly there because they need respiratory support, meaning they need supplemental oxygen. Our most recent number is that we have 124 cases in Texas. 39 of those cases are ages 0 to 4 years. 62 of those cases are ages 5 to 17 years. 18 of those cases are 18 and older, and there are 5 where we are unclear on the age. New Mexico now has 9 measles cases. None of these samples have been linked to the vaccine. I'm seeing that lie go around a lot. The outbreak origin is still not been verified, except we do know that the genotype testing that had been linked to the outbreak of the strain of the measles virus was called D8, and that's currently circulating in Europe and the WHO Eastern Mediterranean region, including North Africa, the Middle East, and Southwest Asia. And I want to emphasize that this is not normal. Despite what RFK said, we do not have measles outbreaks like this every year. We don't. This is crazy. The last death was in 2015, and the last pediatric death from measles was in 2003. This is not normal. And I was also asked about symptoms, so I want to explain that people who are infected will begin to have symptoms within 1 to 2 weeks after being exposed. The early symptoms are high fever and cough and runny nose and red watery eyes. Then a few days later, they develop this telltale body rash. The measles rash is basically the way that we were taught as it's described, because I've luckily never seen a case of measles myself, is a bucket of paint. So the rash starts on your face and it spreads down over the rest of your body. You are most contagious 4 days before the rash appears, and then 4 days after the rash appears.